How we doing? No jacket today, huh? Well, good afternoon, everyone. Per our weekly schedule, I want to thank everyone for coming out to one of our COVID-19 pandemic briefings. The city of Richmond still remains in phase 3 of Governor Northam's reopening plan, Forward Virginia, and the city government remains in phase 3 of our operational plan as well. If you have any questions about the services we provide under phase 3 of the reopening process, we ask that you go to richmondgov.com/COVID-19. And if you have any questions about the status of the Commonwealth, but also the city of Richmond and the governor's plan, we ask that you go to rvastrong.org/reopening guidance. As of this morning, the Richmond City Health District is reporting since the beginning of the pandemic, we've had 5,542 total cases here in the city of Richmond. Unfortunately, we've lost 78 Richmond residents to this disease. I'm going to ask that we take a moment of silence in remembrance of those that we've lost. Thank you. I continue to encourage everyone in Richmond to act responsibly in the face of this pandemic. If not for yourself, then for the more at-risk members of the Richmond community. You're going to hear from Dr. Avula momentarily about our health status, but we have to remain vigilant as cases across the country continue to rise, as the fall and winter are upon us. We will be obviously gathering indoors more, and that means that the lessons that we've learned since the beginning of the pandemic have to be leaned on during this most challenging time, and that means first, using your mask. We are still in the midst of the mask mandate here in the city of Richmond and here in the Commonwealth of Virginia. They are mandatory. If you need a mask, we ask that you go to rvastrong.org/get-a-mask, and you can pick them up for free. Remember, we have a mask network throughout the city with more than 50 sites where you can pick up a free mask at places like your local library. So we ask that you utilize that option. In addition, there's another way you can protect yourself here in our community, and that is to get a flu shot as well. It is also flu season on top of a pandemic too. There are weekly free vaccination clinics around the city from now until December. And we ask you visit the Health District's website or call 804-205-3501 for more information. In addition to providing free flu shots, I'm grateful for the Richmond City Health District in their efforts to provide free testing opportunities as well. There are plenty of free options around the city. The next is tomorrow, November 5, from 9 to 11 a.m. at the 4th Avenue RRHA Senior Building. Once again, 9 to 11 a.m. tomorrow at the 4th Avenue RRHA Senior Building. Remember, these testing events are always free and available to the broad public. You don't have to, whether it's your insurance status, your immigration status, they are free and open to the public. You can expect your results back in 2 to 3 days. And if you have any questions, once again, we ask that you call 804-205-3501. Now I'll have Dr. Danny Avula to come and give us an update on Richmond's health status currently here in a new month, in the month of November. Dr. Avula.
Thank you, Mayor Stoney. Good afternoon, everybody. Well, it seems week in, week out, I come in and offer more bad news. Last Thursday, the United States hit its single-day highest record for case counts at over 91,000 cases in one day. Our trends here in Richmond look like they're heading the same direction as the rest of the country. We continue to see the sustained trend over the last month or so. Our current case rate, 11.7 cases per 100,000 population. Our percent positivity continues to hover just below 4%. And just maybe as one point of context, we had a community testing event last week in Eastern Henrico. Our percent positivity at that single event alone was over 30%. And so there is more and more circulating disease. Again, symptoms are a very good indicator of disease. And if you are at all symptomatic, I would ask that you go and get tested as quickly as possible and refrain from engaging in social activity. As we continue to monitor clusters, it's the same stories. It's continued group gathering, it's weddings, and social gatherings, birthday parties. Consistent over the last 4 weeks as well is the increasing case count among our 20 to 29 population. Couple of other updates. Obviously we had an election day here this week. By all accounts, by my own observations and others, the social distancing and mask enforcement occurred very effectively at polls. But if people are still concerned about any potential exposure, the mayor mentioned a testing event we have tomorrow. We also have 3 testing events coming up next week, and I would ask that you go to our website, rchd.com, or call our hotline, 804-205-3501, if you are at all concerned about exposure and want to get tested. Usually we recommend about 5 days after any potential exposure is a good time to do that. Vaccine updates. I shared last week that we're still awaiting these clinical trials to be completed. It looks like they continue to push those dates back. At this point, we likely will not see the closure of clinical trials until the beginning of December. They still have to go through the FDA emergency use authorization process, and the federal government is now saying, it may be the end of December, the beginning of January before we see that phase 1 vaccine hit the streets. Although the streets is figurative, it'll technically hit hospitals and healthcare organizations and then long-term care facilities. And so we will continue to keep you posted about that and let you know when that first batch of vaccine comes here to Richmond, and where we're deploying that. I've been hearing a lot of questions about holidays. Obviously, we just had Halloween, but now everybody's thinking about Thanksgiving and the December holidays as we head into those. And I guess what I will just offer is that we will need to think differently about how we do family gatherings this year. I think there are steps that we can take, including thinking about what we're doing in the days leading up to that family gathering, how we actually operate during the family gathering itself, and then what we do when we leave that family gathering that will help minimize the chance that you get sick and that you spread COVID to others. So, as you're planning a family gathering, the best and safest thing is to not do it, if at all possible. But I recognize that many families will want to continue traditions and will be willing to do it with some adjustments. I would ask that people think about how much they are cloistering themselves in the days leading up to that gathering. If they can at all quarantine themselves for 14 days and minimize any exposure, that's the safest thing to do. If 14 days is unreasonable, then think about getting tested before you go into that family gathering. At the gathering itself, the same guidelines we've been offering for workplaces and schools and everywhere else. Try to keep as much outside as possible. Try to maintain distance and enforce mask wearing as much as possible. And if at all possible, do not stay within household units. Try to stay in another house and kind of limit your gathering times to meals and other social engagements. And then once you leave that family gathering and come back to home, wherever that is, consider again a 14-day quarantine period to monitor yourself for symptoms. Now I know that this sounds difficult and it sounds crazy to a lot of people, but I think this is the kind of discipline and rigor that we're going to need to put into place if we're going to have any chance of not seeing a spike like we saw saw back in May and in August here this winter. So we will post some guidance shortly on our website, and I imagine there'll be many more opportunities for us to kind of talk through some of the details of how to do holidays safely. But I know it's on everybody's mind, and want to just reinforce the things that we've been saying. Thanks.
Thank you, Dr. Avula, and I just want to add some comments to your request for our community to be careful once again in this holiday season. When we had Halloween just a few days ago, we asked folks to do it safely or do our best to avoid it. We have to obviously tweak our lives a little bit here in 2020 because this is not 2019 or any year prior to that. We have to do some things differently. And what Dr. Avula is asking of all of us in our community, particularly around this holiday in terms of Thanksgiving and also looking into Christmas as well, is that we have to be careful. We have to put public health first. The safety of not only yourself, but also your family too. If you have a grandmother or a grandfather, remember them when taking these steps towards Thanksgiving. Remember them when you plan out this upcoming holiday. They are obviously the ones who are certainly the most at risk, and we need to do everything possible to not only keep yourself safe, but also keep them safe too. With that, we will take some questions. Jim?
Not to jump right into it, but the elephant in the room.
COVID-19?
Exactly.
Let's go.
Obviously, we had a lot of people turn out to the polls yesterday.
Yeah.
Right now, things are still very iffy with the mayoral race. Wondering what your thoughts are at this point with the way that the votes are being counted on the city's registrar website compared to the state board of elections.
Well, first I want to thank every single Richmond voter who participated in the process. This has been a tumultuous year, and to see the number of voters who showed up at the polls, particularly since September 18th, it's something I want to brag about because we had nearly 70,000 people cast early votes between September 18th and October 31st. That's something we should be proud of. And I know that the registrar's office is doing their due diligence to ensure that the public can have these results. Every indication that my team has seen of the results thus far, we feel confident that we are, going to be successful, and there's going to be another 4 years of a Stoney administration. So.
And adding on to that, the city's election board chairman told us not long ago that preliminarily you're up in 6 of 9 council districts. Do you want to add to that?
The question is that the chairman of the electoral board said that we were up 6 of 9 districts. How do I want to add to that? Yeah, I would love to add 3 more districts to it, but it's 6 of 9, and it just shows that we have, we tried our best to build a broad-based coalition from all across the city in multiple districts, from the east end to south side to north side, parts of the west end as well. And I think that you saw voters come to the polls since September 18th who agreed with our positive vision for the city of Richmond, but also they also appreciated our progressive record over the course of the last 4 years. I am elated. I love this job. I love the city of Richmond. And, I am always humbled by the power of the voter, the ability for them to actually choose their leaders. There's no better there's no better way to, I think, let your voice be heard than going to the polls and choosing your leaders. And I am grateful for another 4 years.
And just a follow-up to that, for several hours we were seeing some reporting issues on the registrar's website. Now, this morning, the Department of Elections for the state has been updating a little bit more consistently. Have you been briefed by the registrar what the issue was last night with getting those numbers out in time?
I have not been briefed by the question was the issue between the reporting, the registrar's office, the state as well, the sites not being congruent, I guess you can say. I've not been briefed on it yet, but here's the deal. What I know, Ben, is that this is the first time that we've ever done anything like this before, right? To have 70,000 votes cast since September 18th. No Richmond registrar's office has ever dealt with an election like this. This is in the middle of a pandemic. And I know they're doing the best they can to get the results to the public as quickly as possible. And I appreciate the work of many of the staff over there that have been working their hearts out since September 18th.
Mark?
Have any of your opponents conceded to you?
I've not received a phone call from any of my opponents. The question was, have any of my opponents conceded to me? I've not received a phone call from any of my opponents.
Do you believe, standing here right now, that you've won outright?
Yes. The question was, standing here today, do I believe I've won outright? Yes. Every indication that we've seen is that we won 6 districts. And last time we won 5 districts, this time we won 6 districts. I believe,
I'm sorry to interrupt. What are the 6 that you believe that you won?
I mean, I'm going to let the registrar's office provide the official update to the city, but my team has done some diligent work, as I said as well. They've tracked this from, I've been working on this campaign now since the beginning of the year, and the areas that we thought we could be successful in, we believe we were successful in. It's parts of South Side and the East End and North Side.
Matthew, you good? Dan, do you have a question?
Yeah, we had a couple of voters reach out to us yesterday while voting at the Wickham Court precinct. They had indicated they saw no local races, including the mayoral, on their ballot. They had said, one had quoted that they felt like they were robbed, given how close it was at the time with the Richmond mayoral and other races. Is there anything that can be rectified at this point to solve that issue if it was the case?
The question was about the issue at Wickham Court, and there were not local races on some of the ballots. Obviously, that was obviously a concern in my campaign as well, as being a local elected official on the local ballot this time. We asked about it. They, I think, did their best to rectify the issue at hand as quickly as possible, getting in touch with some of those voters as well. But what I do respect from the registrar's office, that what they did was, they do their best to bring about a fair election. And I know that, what we see from yesterday, is that we can continue to improve upon the way we go about doing that. And this might be an improvement we see in the process moving forward.
So your campaign was told that that issue had been resolved?
It was brought to our attention by those on the ground, and obviously we reached out to the registrar's office and the electoral board to try their best to rectify the issue.
But they didn't tell you if it had been rectified?
They told us they were able to reach out to some of the voters who may have been, but also, here we got provisional ballots that are available to those who feel like that the ballot was incomplete.
Mark, do you have a question? You good? Priya, you good? Oh, yeah.
Has the registrar indicated to you when those final results will be delivered to the public?
The registrar has not talked directly to me, but we hope to see those results provided to the public hopefully by the end of the day. And I think when those results are provided, I think you'll see that we believe that we have the necessary number of districts to be the victor in this election.
Do you have any comment on the council outcomes? I know that there were a lot of incumbents who were seeking re-election, but there were also some candidates who were running and challenging some incumbents that have been very vocal and critical of your administration in some of these key items. I'm curious of your thoughts on it.
The question was, do I have any comments on the council elections? First, I'm not going to comment on anything until I know the details of the outcomes of all those elections. But I will also state that, first, I think every individual who chose to run for office, whether in school board or city council, those who ran against me as well, running for office, I think, is one of the bravest, most courageous things you can do. And I appreciate I appreciate every one of them put themselves before the public to lead our city, whether it's in their neighborhood or citywide. Also, I will say that, you know, I'm going to double down on unity, not on division. And my door will remain open to all of those who are elected to the city council for us to continue to move a progressive, positive agenda forward for the residents of the great city of Richmond.
Last question, Karina.
The Richmond Electoral Board Chairman actually just released a picture of numbers from the district showing you with a substantial lead in 6 of 9 districts, pretty much saying that you will be the mayor for the next 4 years. Do you have comments hearing that after we've just kind of seen a photo of it right now? I don't know if you.
Now you're catching me off guard a little bit here.
You know, breaking news.
You know, this has been it's been a long, challenging year. Been a long, challenging year. And I think what the voters have seen from me and my administration is that we love the work that we do. And, you know, I am always humbled. I'm humbled by the opportunity to serve as the mayor of the city, because not only do I love what I do, I also love the people of this great city, and I just love the city. And to get another 4 years to complete the work, as I've stated in the past, is the greatest honor of my life.
Thank you very much, everybody. Appreciate it. Thank you.
Thank you.